The history of CQL, the Council on Quality and Leadership. Since 1969, CQL has been a leader in working with human service organizations and systems throughout the world to continuously define, measure, and improve quality of life and quality of services for youth, adults, and older adults with intellectual and developmental disabilities and psychiatric disabilities. CQL's vision is a world of dignity, opportunity, and community for all people. CQL believes that every person deserves respect, dignity, opportunity, and to be included in the community, whether they have a disability or not. That vision drives our mission of being dedicated to the definition, measurement, and improvement of personal quality of life. CQL has a long and rich history of conducting accreditation, training, certification, research, and consultation. We were formed in response to the injustices and deplorable treatment of people in public institutions being brought to light in the late 60s, early 70s. In 1969, a national planning committee under the Joint Commission on Accreditation of Hospitals, now the Joint Commission, including industry leaders like AAIDD, the ARC, the Council for Exceptional Children, and United Cerebral Palsy, led to the creation of the organization which is now known as CQL, the Council on Quality and Leadership. The first edition of standards, which contained over 700, was developed by CQL in the early 1970s in an effort to end the inhumane treatment and abuse of people with intellectual disabilities in state institutions. CQL then took on a leadership role in developing expectations for community-based services, which were the basis for landmark court decisions like Wyatt v. Stickney. Federal courts later merged CQL standards into legal settlements in Texas, North Dakota, California, Arkansas, West Virginia, and other states. CQL was reorganized as an independent, not-for-profit organization in 1979, most commonly known as the Accreditation Council. Anchor and the Autism Society were added to the founding team of organizations at this time. CQL continued to develop new and updated national consensus standards throughout the 1980s. The Healthcare Financing Administration, HCFA, now known as Centers for Medicare and Medicaid Services, CMS, based its regulations on the CQL standards, which were ultimately published in CQL's 1984 edition of Standards for Services. In 1987, the revised Standards for Services for People with Developmental Disabilities was published. In 1990, CQL began work on what were then called the Outcome-Based Performance Measures, now known as the Personal Outcome Measures. We will talk more about them in just a minute. In 1997, the organization was renamed the Council on Quality and Leadership, or CQL. The Quality Measures Model was introduced in 2005, integrating multiple CQL tools, including shared values, basic assurances, responsive services, personal outcome measures, and community life, all into one cohesive package. CQL's What Really Matters initiative came to life in 2010 and outlined 34 success indicators that characterize person-centered supports and promote personal quality of life outcomes, which together result in person-centered excellence. Now back to the personal outcome measures. In the early 1990s, CQL realized that people who use services needed to be included at the table. CQL began work on the now internationally recognized personal outcome measures. Some people refer to the tool as the PALM. CQL invited people with intellectual and developmental disabilities, people with psychiatric disabilities, families, and other thought leaders to participate in focus groups to discuss quality measures. There was a big difference in what people and their families wanted compared with what professionals wanted. The personal outcome measures were developed and piloted in 2 states, at 3 organizations, and then field tested in the US and Canada. In 1993, the first PALM tool with 30 outcomes was published. Over the years, data analysis led to the combination of several outcomes, reducing the number to 25, and then to the 21 we have today. The personal outcome measures were revalidated in 2017 and reorganized under 5 factors. The CQL journey continues with the daily work of establishing real connections between disabilities theory and practice. The CQL portal data system now contains tens of thousands of PALM interviews, as well as hundreds of basic assurances assessments. Quality of life is why CQL is committed to partnering with providers and systems for organizational transformation.